Understanding and interpreting electrocardiograms is an essential skill for AEMT and paramedic students, as it plays a critical role in diagnosing and managing cardiac conditions. We're going to simplify the process by breaking down the key concepts and providing practical tips for accurate electrode placement and EKG reading. Let's get started. An electrocardiogram, or EKG, represents the electrical activity of the heart as it contracts and relaxes. The different waves on an EKG correspond to specific phases of the cardiac cycle, and understanding these can provide crucial insights into a patient's heart health. A P wave is the first positive deflection on the EKG. It represents atrial depolarization, which is the electrical activity causing the atria to contract. The isoelectric line is the flat baseline from which all EKG waves originate and return. It serves as the reference point for measuring wave deflections. The Q wave is the first negative deflection in the QRS complex. It is part of the ventricular depolarization process. Note that not everyone has a Q wave, so sometimes the QRS complex may consist only of the RS waves. The R wave is the first positive deflection following the Q wave, if present, in the QRS complex. It is a major component of the ventricular depolarization process. The S wave is the first negative deflection following the R wave in the QRS complex. It completes the QRS complex, representing the final phase of ventricular depolarization. The QRS complex represents ventricular depolarization, which is the electrical activity causing the ventricles to contract. The T wave is the positive deflection following the QRS complex. It represents ventricular repolarization, the process of the ventricles relaxing and preparing for the next contraction. Atrial repolarization does not have a visible wave because it is hidden within the QRS complex. Intervals on an EKG represent the time periods between specific wave points. These intervals are crucial for understanding the timing and coordination of the heart's electrical activity. The PR interval is measured from the beginning of the P wave to the start of the QRS complex with a normal range of 0.12 to 0.20 seconds. This interval indicates the time it takes for the electrical impulse to travel from the atria to the ventricles, reflecting AV node function. The ST segment is measured from the end of the S wave to the beginning of the T wave and is significant for identifying myocardial infarction, heart attack. Elevation or depression in this segment can indicate ischemia or injury. The QT interval is measured from the beginning of the Q wave to the end of the T wave, with normal ranges of 0.35 to 0.45 seconds for males and 0.36 to 0.46 seconds for females. This interval represents the total time for ventricular depolarization and repolarization, and abnormal QT intervals can indicate a risk of arrhythmias and other cardiac conditions. By understanding these fundamental components and intervals, you'll be better equipped to read EKGs and respond effectively to cardiac events in the field. Keep practicing, and soon identifying these waves and intervals will become second nature. When analyzing EKG, electrocardiogram results, it's crucial to understand the basics of EKG paper to ensure accurate interpretation. The paper is divided into small and large boxes, each with a specific time value. Here's a breakdown. Each small box on the EKG paper represents 0.04 seconds. This measurement is essential for calculating the heart rate and identifying the timing of various EKG components. Each large box is made up of 5 small boxes and represents 0.20 seconds. This helps in quickly determining time intervals and spotting any abnormalities in the heart's rhythm. To easily remember where to place the electrodes, use this mnemonic. Refer to white electrodes as snow and place them on the right arm. Think suns, snow over grass. Refer to green electrodes as grass and place them on the right leg. Think suns, snow over grass. Refer to black electrodes as smoke and place them on the left arm. Think smoke over fire. Refer to red electrodes as fire and place them on the left leg. Think smoke over fire. When placing electrodes on the arms for an ECG recording, position them on the outer aspect of the humeral heads, which are the upper arm bones. This placement helps reduce muscle artifacts and ensures a more stable signal by avoiding interference from chest muscles or other upper body movements. For the legs, place the electrodes near the ankles to minimize motion artifacts caused by leg movements, providing a stable base for the ECG recording. Ensure the electrodes are positioned similarly on both legs for consistent and accurate readings. Clean and dry the skin before placing the electrodes. Shave any excessive hair and use alcohol wipes to enhance electrode adhesion and signal quality. Always place the electrodes in the same positions for consistency in readings, which is crucial for monitoring changes over time. Ensure all electrodes are properly connected to the leads, with no loose connections that could affect signal quality. Excessive movement can create artifacts in the ECG reading. Encourage the patient to remain still during the procedure for the most accurate results. By following these guidelines and using the mnemonics, you can efficiently and accurately place ECG electrodes, leading to better patient care and more reliable ECG interpretations.
Click the link in the video's description to download EMS Pocket Prep and study any of our 7 EMS exam offerings. Pocket Prep is a mobile, quiz-based study platform designed to provide effective, engaging, and affordable study material for a wide range of certification and licensure exams. Download the app and start studying for free today.